To get to rapid eye movement sleep, we go through 3 other stages of sleep. A light sleep, which is only about 5% of our sleep time, then through delta and slow wave sleep, and then finally into the magic kingdom of rapid eye movement sleep. What's important about rapid eye movement sleep is that is not only the place where we get the most restorative regenerative sleep, but during that period of time, our muscles in our body all go into a fully relaxed state, save and except 2 sets of muscles. The orbital muscles of the eyes and the cardiovascular system. The sleep stage draws its name from the fact that the orbital muscles of the eyes cause a twitching back and forth, like the patient is watching a ping pong match. It is a phenomenon like the Northern Lights. It has no physiological importance. The other set of muscles are the cardiovascular system, otherwise we wouldn't wake up. But in true sound REM sleep, what will happen is every muscle in the body, save and except those 2 sets, will go into full and complete relaxation. Well, when that happens, the second of what I call nature's mistakes kicks in. If you recall, the first of nature's mistakes is to predispose us to this problem by inheriting a small airway. The second one, however, has to do with how our lower jaw is hinged and how it relates to our upper arch. And I would like to take you through now what I call the anatomy of sleep and how this relaxation of muscles adds the important additional ingredient in the blockage of the airway. The second of nature's mistakes is very easy to point out and easy to understand. It is simply that while the patient is lying on their back, and it is a fact that most people prefer to sleep on their back, that's the way the organism functions. But when that happens, as we've talked about, all of the muscular relaxation that takes place, the weight of the teeth, the jawbone, the tongue, and all the flesh that hangs around this apparatus turns the most complicated joint we have in the body that allows our jaw to move. It is affected in speech, it's affected in swallowing. But during sleep, what happens is that the teeth, the jawbone, and the tongue cause the airway to be plugged because as the jaw falls, it forces the tongue back into the airway. If you recall walking to the back of an airplane that's been in the sky more than 2 hours, what you will see is people who are trying to sleep or have gone to sleep, and they will have a common posture. They will look like this. Their jaw will fall. As it falls, the tongue is pushed back into the airway. And remember, the airway is a small aperture that sits right there, right behind the tongue. And as the jaw falls back, it has nothing that it can do but force the tongue into the airway. Now, if you think about the airway as being a small aperture, in some patients it's very small, others it's larger. The larger the airway is genetically, the less chance there will be that you will be a snorer. But whatever that airway size, let's presume that it's small. As this phenomenon of the jaw falling back takes place, then the tongue is going to get pushed into the airway. It's going to block it off little by little by little. As it blocks it off substantially, now what happens is that patient is having to work to breathe. They're having to push the air out, pull the air in. It takes muscular effort to do that. So that instead of sleeping soundly and resting properly, this patient is having to work to breathe. During that period of time, of course, the airway becomes pressurized. And an old physical phenomenon from our high school days kicks in. Bernoulli taught us generations ago that if you force a substance through a confined space, you create pressure. If you take a garden hose and squeeze it with a little bit of flow of water, you will find that there will be noise. That noise is coming from the turbulence of the water going through the closed aperture. In the airway of the human, as that shuts down, it's the turbulence of the air going through the soft tissue of the airway that causes the vibration in the tissue that is the snoring problem. However, when that airway gets down substantially closed, what occurs is the pressurization that goes on creates a negative pressure in the lungs and can actually pull the tongue right over top of the airway. So now we no longer have a simple passive blockage of the airway. We now have an active plugging of the airway which prevents all of the passage of air and obviously oxygen into that lung of that patient. The trigger to the breathing reflex in the brain is the level of carbon dioxide in the blood. So as we shut down the oxygen supply, the patient is still alive, and carbon dioxide is being dumped into the bloodstream, so up goes the CO2 levels in the brain. When they get to a significant level, the body is starting to say, Wayne, knock knock, we have a serious problem here, we need to fix this, and the messages start flooding from the cortex to the diaphragm, and at some point in time, hopefully, the airway will open because the organism will say, I need that air bad enough that it will force the airway to fly open. And the typical end to a sleep apnea event is a gasp. It's a that many of you who sleep near, in, and around a sleep apnea suffering patient will recognize. Many times in the patients I see, it's not so much the snoring that is bothering the partner, but it's the intermittent silences that indicate that there is a blockage here, and is that patient going to awaken? And it's critical that we ensure that our patients awaken. Now that we know why we have this problem and what factors influence the degree to which we have it, let's turn our minds to what could we do about it. Well, there are 4 avenues that we can follow. The first one would be lifestyle. If weight is a big factor, if we're 20 pounds, 30 pounds overweight, weight's going to be a big factor here. But merely losing the weight may not solve the problem entirely, because it's only one of the factors. But it's certainly no argument can be made against the fact that if we are heavy, losing that weight may help dramatically.